Hello, my name is Dr. Mizoon here at United Dental. I wanted to answer some questions today regarding tooth extractions. So some of the questions we're getting now are, what are the reasons tooth extractions may be necessary? Well, the number one reason that a tooth extraction would be necessary is that the tooth cannot be saved. It's not restorable. If we can't fix the tooth, if we can't put a crown or do a root canal and save the tooth, then that's when the tooth needs to come out. And then there's options to replace that tooth, whether it's a bridge or an implant, which is always discussed with our patients. What are some types of tooth extractions is another question. And there's simple extraction where the whole tooth is still intact and it can just be taken out in one piece. And there's a surgical extraction, which is, it's gonna break and the oral surgeon takes it out piece by piece. When would a dentist recommend wisdom tooth extractions? This is a good question. If the wisdom tooth is impacted and causing pain, pressure, or food is getting impacted and causing gum disease around the area and the tissue, then definitely we do recommend extracting wisdom teeth. When would braces require tooth extraction? Sometimes if a person getting orthodontic work or braces doesn't have enough room in their jaw, then the orthodontist would recommend having some bicuspids removed. Therefore, they can, move the teeth much better to alignment, and just that creates more space. Is tooth extraction and filling advisable for young children? Well, if the tooth is not, it can't be saved, then the tooth has to come out. Or if they need braces, that would definitely be another reason why children may need to have their teeth extracted. Another question is, if I have gum disease, when would tooth extraction become necessary? This is a very important topic in that gum disease or periodontal disease causes bone loss. So from the gum disease that leads to bone loss, and once you have bone loss, there's no support for the teeth. So those teeth need to come out and get extracted. Are all tooth extractions considered oral surgery? Definitely they're under the category of oral surgery, whether the general dentist does it or you refer out to an oral surgeon. In our case, we have an oral surgeon who comes to our office and does a lot of the work here. What is the difference between simple versus surgical tooth removal? Again, simple is when the tooth is still intact, and that's just an easier extraction. If it's really severely decayed and broken down, then it comes out in pieces, which is called a surgical. It breaks, and they have to section it, and the oral surgeon takes it out. Where should I go if I need an emergency tooth extraction? Well, you can always call your general dentist to have the emergency visit. Usually we start with a consultation, and if we can do it here, the extraction will be done here. If not, we refer to the oral surgeon nearby. How long does a tooth extraction procedure take is another question. Well, it depends on what type of extraction, how many extractions you're getting done. Typically we schedule about an hour, and our oral surgeon does a few extractions during that time. Will I need dental implants after a tooth extraction? Well, there's different ways of replacing a missing tooth. Definitely dental implants have become very popular over the years, and we do them routinely in our practice. Other options would be, if a patient doesn't want to get an implant, it would be a bridge or a partial denture. There's different scenarios that we will go over with the patient. Will the dentist put me to sleep during tooth extractions? Sometimes we do some sedation with, we don't do IV sedation in our practice, but we do give them, something to just calm them down, a pill that they would take before the procedure. If a patient wants to be put totally to sleep or IV sedation, then we would refer out to a nearby oral surgeon who we work with. How do I brush my teeth after a tooth extraction? We typically tell the patients to avoid brushing in that area, and to rinse with warm salt water to make sure the area heals faster. What should I know about tooth extraction aftercare and recovery? We go over all these post-op instructions after the surgery with the patients, but we ask that they take their meds. There may be some antibiotics that are prescribed. We make sure that they keep the area clean and rinse after meals, so that there's no food debris getting into the extraction sites. Why should one avoid rinsing after getting a tooth extraction? You just don't want to rinse very aggressively so that the blood clot that's formed dislodges from that extraction site. And that's what really causes a person to have dry socket. The other reason you would get a dry socket is from smoking. So we tell patients not to smoke at least a few days after their extraction. How long should I wait to exercise after a tooth extraction? Exercise is usually okay, maybe the first few days. We ask that you take it easy and just relax, take your meds, and just make sure you heal before doing anything too strenuous. How long should I take to recover from a tooth extraction? Again, about a few days is what we tell patients. They normally take their antibiotics for 1 week. Pain meds usually just the first few days, and then they don't need pain medication after that. And the last questions one of the last questions that we get is, when should I schedule an appointment for a tooth extraction? So first things first, we always schedule a consultation. You would come in, meet an oral surgeon. They would recommend whatever they think that you need. And then we go over financials and make sure that you understand what your financial responsibility will be. And then an appointment is set up to come back and get the procedure done. Hope this was helpful. Please call our office if you have any questions about extractions. Thank you.